are as full as we have ever been, and I think that this is similar to other children's hospitals across the nation.
Children's hospitals around the country, including Nemours Children's Hospital in Delaware, are filling up quickly with a potential triple-demic of RSV, flu, and COVID. RSV is the big driver right now, and doctors are dealing with this typically common respiratory virus in larger numbers and way earlier in the season than usual.
Nationwide, health officials say pediatric beds and intensive care units are now about 80% full, and that's because of RSV. Wolfson Children's Hospital didn't have an exact number, but says it's seeing a higher number of RSV cases than this time in years past. A local pediatrician says she's seeing RSV cases daily with children under 2 years old.
Either put the mask on or vaccinate or make me happy and do both. But it's like sending a soldier to war with no guard and no ammunition. And the soldier is your child.
Hey you guys, Blaze here. Ooh, a triple-demic. COVID, the flu's all of a sudden magically back from a long vacation, and hospitals are full of little children with RSV. Well, let's talk a little bit about RSV. RSV stands for Respiratory Syncytial Virus. It affects the lungs and breathing passages and has cold-like symptoms. Most people recover from RSV within a week, but those with low immune systems or at high risk may develop pneumonia or bronchitis. So why all of a sudden are so many children getting this? Well, think about it for a minute. It doesn't take a rocket scientist to figure this out. It's either one or two things, or a combination of both. Children that's parents have made them get the vax are getting sick, and vaxxed parents and teachers are shedding on children, making them sick. Or, for the last almost 3 years now, they've been forcing everyone to wear face masks. Even little children have been forced either by their parents or forced at schools to wear them all day long. Children cough, sneeze, they drool, and they may have leaky noses all going into the face mask that they're wearing. Some kids chew on them, lick the inside of the mask, and often take them off to play with them. This leads to all kinds of germs and bacteria building up on the mask. Children forced to wear them for long periods of times are breathing in the mask microplastics, which build up in their lungs. This goes for anyone wearing a mask, but we'll stick to talking about children in this conversation.
My name is Austin Dean, and I did research on face masks and breathing microplastic fibers. To do this, I tested face masks at 1, 4, and 8 hour increments. I used a vacuum to simulate human breathing, and this would pull 5 liters of air per minute through the face mask, dislodging any fibers, and these fibers would collect on a filter below. The filters were then collected, and the fibers on them were fingerprinted with FTIR analysis. I used 7 different types of masks for this experiment. 2 types of disposable, 3 types of medical grade disposable, and then 3 types of reusable. For the reusable masks, I tested them 3 times. Once after opening them. After testing the first time, I would wash them, test them again, and then I would wash them one more time for the 3rd and final test. This graph shows a mask comparison between cotton, polyester, and blue disposable masks at 1, 4, and 8 hours. You can see that the cotton reusable had the most fibers at each time increment. So it shows that each mask is not created equal, and depending on the material and the quality of your mask, it's going to determine how many fibers you're breathing in. Here is the analysis of one sample set, reusable cotton 1 hour testing. This is the first test with no wash, the second test with its first wash, and the last test with the second wash. As you can see, we split the fibers and the particles into 2 groups, the non-synthetic and the synthetics. The non-synthetics are going to be your things like cotton and cellulose, and the synthetics are going to be the things like plastics. In the cotton testing, we found all the non-synthetics to be cotton. This was not surprising, as this was a cotton mask being tested. Of the synthetic fibers that we found, they were all PET. PET is a plastic that is found in polyester, and it is used commonly in today's clothes and textiles. When analyzing the fibers, we found that every non-synthetic fiber turned out to be white, and every synthetic fiber turned out to be black. So using this information, we were able to discern what the remaining fibers and particles on the filter were. In this graph, we see the results of the cotton test, the no wash, first wash, and second wash. For the no wash, we see that we had just about 230 fibers found. 79 of these turned out to be synthetic or black fibers, and this is that PET fiber. After washing it once, the number of fibers cut down to below 50. But then after washing it a second time, the fibers then jumped back up to just short of 300. But this time, the amount of plastic fibers that we found was only 10, compared to the 288 fibers that we found that were believed to be non-synthetic fibers. My final slide here shows a picture of one of the masks that was used in this cotton fusible experiment. This research is important because the amount of fibers that you inhale, we don't know if that can be expelled from the lungs or if it will accumulate in the lungs. We do know that a buildup of fibers can cause inflammation, but the long-term effects of that remain to be seen.
Forcing children to wear masks for almost 3 years has lowered and ruined their immune systems. Children's immune systems are still developing as they age, and because of masks, they haven't developed strongly. I literally been saying ever since all this crap started that putting little children in masks is pure child abuse. It's going to cause them serious health issues later on. And I got laughed at, insulted, and called a conspiracy theorist. And wow, now it's happening. All this combined can cause serious health issues such as lung problems, breathing problems, pneumonia, bronchitis, and of course, RSV. This should be common sense, but for the past 3 years, common sense is something that 99.9% of most people just don't freaking have anymore. So, what are doctors' solutions to prevent RSV? Well, of course, keep making your children wear face masks and go get them the flu shot and the COVID shot. And don't worry, they're working on an RSV shot as well.
Here to explain is Dr. Paul Sachs, Clinical Director of Infectious Diseases at the Brigham. Dr. Sachs, thanks for joining us.
Thanks for inviting me.
Well, Dr. Sachs, as you well know, health officials recommended face masks. In fact, we're still wearing them in medical facilities. Social distancing, even lockdowns to slow the spread of COVID, but it also slowed the spread of a number of other viruses. We had no flu, in fact, for about 2 years. Do you think that's why we're seeing so many cases, though, right now?
Well, I think the striking thing is that cases are back to normal. In fact, they're a little early being back to normal. And what's so alarming about it is that we now have flu, we have RSV, and we also have COVID-19. So all three of them together, which means that we are seeing a lot of people with respiratory viruses of various types.
So speaking of that three, folks calling it a possible tridemic, that RSV, the flu, COVID. Are you seeing any signs of that happening at the Brigham yet, all three?
Well, what we're seeing in actually the entire United States is an increase in all three respiratory viruses. And I think we can expect that. We have to be prepared that this season, as the winter season comes, there are going to be more respiratory viral infections. That's true every year. In fact, the only year that's an exception were the years of the pandemic, when the only virus we really saw was COVID-19 because it's so contagious. The thing to remember about these other viruses, though, is that first of all, there is a flu vaccine, and it is partially effective, and I highly recommend people get it. And for RSV, the really vulnerable populations are older adults, particular people older than 65.
Well, let's talk about RSV. We've talked about the threat for younger kids, especially because they were protected from it largely for the last 2 years, especially toddlers and infants. But the CDC says the virus can also be fatal for older adults. So what can you tell us about their risk, especially as you know we're quickly coming up on the holidays, grandparents get together with their grandchildren? What should they know?
Well, the first thing to realize is that most, even older adults who get RSV, they really feel like they just have a cold. It's for the minority who get very sick. But when you do get sick with RSV, it can cause a bad pneumonia, just like in some ways COVID-19. And the key for here is prevention. And the way that we believe most of these viruses are spread are predominantly by the respiratory route and also by contaminated surfaces. So if you're in a crowded setting, by all means, I think masking still makes sense for people at risk, and that accounts for a lot of the cases. And then also the good news is we've just heard some information about an experimental RSV vaccine that looks very promising. In fact, there are 2 vaccines in the works, and it wouldn't surprise me if fairly soon, maybe not this season, we have an RSV vaccine to offer to our older, more vulnerable patients.
And trust the doctors and the science that they spit out, because the flu magically disappeared for a couple of years because we all social distanced and wore face masks. But the evil COVID spread and supposedly infected and killed millions of people around the world. Though they say the COVID virus is the size between 60 to 160 newton meters, which is actually similar to the same size as the flu, which is 80 to 100 newton meters. So funny how they claim face mask literally stopped the flu for a couple of years, but it didn't stop COVID. But hey, who am I to question that? Trust in the science.